So regarding shoulder health, we're always thinking about how our scapula, which is the wing bone on the back of our shoulder, and our rib cage work together. Now we've got a concave and convex structure. So the scapula sits on top of the rib cage. Now if our rib cage is nice and round, and we'll talk about how to do that, okay, well our scapula will rotate upwardly against the rib cage. Now this allows all of the muscles around the shoulder to work at optimal length. So the rotator cuff, all of the four rotator cuff muscles can act optimally if we can get this scapula to upwardly rotate. When we are executing shoulder health exercises, we want to ensure that we appreciate the relationship between the pelvis and the rib cage. So we don't want to dump into anterior pelvic tilt, because this is going to fire our rib cage forward. It's going to then create a different kind of relationship between the scapula and the rib cage. So we're just making sure we've got our pelvis engaged in a nice strong position, so that we can always get that last degree of upward rotation of the scapula, making sure it's actually happening at the scapula and not lower back extension. So for example, so that last degree is really important to make sure that that rotation is occurring. If we can get that scapula to upwardly rotate nicely, we're going to ensure that the rotator cuffs are working at optimal length. Okay, so if the scapula is a little bit low, okay, when throwing, that's going to make things really difficult. So we want to make sure that muscles are working at optimal length. We want to make sure that the scapula is moving up and around the rib cage, and we want to appreciate the relationship between the pelvis, the rib cage, and the scapula.